There we go. Fantastic. So super excited today to see all of you, and especially excited to have Dr. Betsy Board with us. And yeah, welcome, Betsy. So great to have you on there. Just so great. Been waiting for this moment for a long time, so just thrilled to have you on and hear more about you. What I want to do is just give a little bit of an introduction so you know Dr. Board. And she was the first medical doctor in Georgia to actually become board certified by the Institute of Functional Medicine. And she's the founder of Atlanta Functional Medicine, which is located in Alpharetta, Georgia. So Dr. Board is also trained, she's a highly trained physician, not just in functional medicine, but also in pain management, medical acupuncture, anesthesiology, always get my tongue tied with that one, and Neuro-Endo-Immune Certified. And fill me in if I've missed anything out, because I know you are continually learning. But yeah, I mean, for Dr. Board, after practicing as pain management physician, really developed an interest in alternative methods of bringing about pain relief without placing patients on large doses of drugs that lead to dependence and cause sedation. So this is what we're just going to hear today. I want to go through and give you some insights, and Dr. Board's going to give us some insights exactly. Also want to let you know that Dr. Board is a phenomenal athlete. She practices exactly what she preaches, and that's what I love about her. So she just really loves helping others grow their functional medicine knowledge, and that is why she is our main physician, along with Dr. Parvis, in the Functional Medicine Fast Track program, and she is an educational collaborator at the Institute of Functional Medicine. So you couldn't really get anybody better chatting to us today. So maybe, Betsy, if you want to just start off and tell us a little bit about your background. I know I've given an introduction, but maybe you want to give us the juice behind that and how your medical career kind of started.
All right, thanks, Garric. You know, what happened initially with me is I was an anesthesiologist. I found that I really loved doing obstetric anesthesia because I had more contact with the patient. I loved doing injections. I loved kind of coaching people even when they had their babies. So I went from doing a fellowship in obstetric anesthesia to going on to do a pain management fellowship. And I trained on the West Coast, so you know we were open to alternative things. Some of my professors were using acupuncture at the time. But there at Stanford, what we did is we took people off of pain pills, and we found other ways to treat their pain. And this really opened my eyes to that whole practice, because I was not interested in to become a pain physician that was going to write prescriptions. That was not interesting to me. So when I came back to Georgia, unfortunately, for many years, that's exactly what pain physicians were doing quite a bit. And I really knew that I was going to have to either change fields. I even considered going into law, believe it or not, because I wanted to help people without creating new problems for them. Because when I did practice pain even in Georgia, many of our patients were on huge amounts of opiates. They were falling asleep in front of you. Those that were getting injections for their chronic back pain or neck pain, many times using steroids, you know, this was leading to them to gain a lot of weight. Their diabetes was getting worse. I would see the list of medications that they were on getting longer and longer, not shorter. And I didn't want to be part of the problem. I really wanted to be part of the solution. That brought me to become interested in anesthesia. And I had a best friend at the time that was a practicing integrative medicine physician. And she told me, you really need to learn functional medicine, because functional medicine is the biochemistry behind getting people better, you know, that have chronic conditions. And that's how I first watched my first video of, from IFM about functional medicine. And once I saw that video, I decided that's what I wanted to do. I didn't have to go into law.
Easy decision, was in your blood.
Yes, yeah, absolutely.
So just staying a little bit in that traditional setting where you were before, what were some of the side effects that you were seeing with patients that were just going through that medication stacking besides gaining weight? Why were you just like convinced that that wasn't the right route for them to go?
Well, you know, and I think a lot of people see this, but they start on one opiate, and before long, that opiate is no longer functioning to give them pain relief. So the opiates had to go on higher and higher dosages. And now the person really isn't even themselves anymore. I remember when I was in California training that family members, when we took them off of their opiates, would say, I've got my grandfather back, or I've got my dad or my husband back. So being on that amount of mood altering medications, because opiates do that in addition to relieving pain relief, or providing pain relief, those things do change the personality to a certain extent. And that's where that whole neuroendocrine piece comes in. We now know that you place a man on opiates long term, their testosterone levels are going to plummet. I mean, that's that connection between the neurology and the endocrine system. And I don't know that pain physicians, I was never taught that, even at such a great institution where I trained. In functional medicine, we are trained to look at the interconnections. When I put somebody on an opiate, I have to look at all the systems, the communication system, which would be neurotransmitters and hormones. I have to look at the immune system, which is also going to be affected by being on opiates. I have to look at the digestive system, which is going to be this is the beauty of functional medicine, in the sense that it, when we put somebody on a medication, or we have an intervention, whether it's surgery or just a procedure, once you become a functional medicine practitioner, you're looking at the impact of everything that you do from a much more broad basis, and that's how you can help the patients better. So that's one example of people on opiates that they develop a dependency, which affects their cognitive ability. It changes their personality. It's going to change the amount of hormone that they produce. There can be other conditions, such as in our older patients, they're more susceptible to infection, lots of things like that. And then going back to I was mentioning about the steroids. Another thing that a lot of pain physicians do is they use a lot of steroids. And you only can do this to a certain extent before you're starting to develop things like osteoporosis in our patients. You're starting to develop diabetes or accelerate diabetes in a diabetic patient. These patients, and do, like we said, do gain a lot of weight in addition.
Yeah, so interesting hearing it from that perspective. And with what you know nowadays, what kind of tests did you do previous to look at other systems? Did you check any other systems? Did you look at the gut? Did you look at, hormonal levels or anything like that? Or was it pretty much focused on this is what you were taught and you stuck with?
Wow, Garric, that's a great point. I never thought about it till this moment, but we weren't taught to even be concerned about that. We were concerned about how, what's the patient's pain level, and, when was the next time they could get a steroid injection, for example. We were never taught to look at blood levels in any other way. And I feel bad, looking back on that, all those patients that we treated that way. We never looked at even blood sugar levels. We never looked at hormone levels, none of those things, which a functional medicine practitioner would never do an intervention without looking at the impact on all the body's organization.
And how did that make you feel just as a person? What were the emotions that you felt in that situation where you were kind of trapped in a conventional system of medication stacking and you knew it wasn't the answer? What was the emotion that you felt?
Actually, it was devastating. It was life-changing. I mean, it was so devastating for me because I couldn't sleep at night. I thought, I am creating people that either are becoming addicts or they're becoming dependent. If they weren't addicted, they were dependent. I'm actually participating in the destruction of the family unit to a certain extent, because I could see, the interaction between the family members. And I didn't want blood on my hands. I didn't want to be part of that. I can remember even some of our patients, I would wonder where certain patients were, and we'd find out later they'd passed away. I didn't want to be involved with that anymore. And it's not to say anything bad about my colleagues, because, we were able to relieve pain in the short term. There's no question that we were able to remove a lot of suffering in the short term. But it just doesn't make sense as a long-term solution. So getting back to what you asked about, I was really devastated, and so devastated that I was going to leave medicine and become an attorney. And it wasn't until I was given this opportunity to look at the benefits of acupuncture and also functional medicine, bring them together and consider that maybe I could actually help someone relieve pain and at the same time create more homeostasis in their body, which is what functional medicine can do.
And So I'd love to now transition and just tell us how you transitioned to that functional medicine, medical acupuncture, and how did you move your practice out of patients coming to you being expecting medication, and then you saying, no, 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 today there's no medications, like this is now my new approach. How was that transition for you?
Well, I had it a little easier than some folks may do. So I opened, I joined a practice that was an integrative practice. And unfortunately, the person who ran that practice passed away, really from regular medicine, but that person passed away. And so I inherited this integrative practice. And it was when I had just started my functional medicine training. And I remember thinking to my friend who had passed away, you've left too soon, I'm not ready. So she had kind of mentored me in the beginning. But, you know, there's that saying that, you know, God equips, the saying is that God doesn't call the equipped, he equips those who are called. That's what I'm trying to say. I had people tell me that so that I had enough courage to believe that even though I felt like I hadn't had enough training, that I was going to be able to do this. So I jumped in there and worked within this integrative practice. So what we did from the get-go, because I didn't want to get caught prescribing opiates. So what we did is on all of my cards, it said non-narcotic pain management. All over our website, non-narcotic pain management. And I trained my staff to know from phone calls to let our patients know that we weren't going to be prescribing opiates in this practice, and that if they were interested in pain relief in other ways, that this was the practice for them. That's kind of how it is.
Yeah, I love it. And I love what you mentioned earlier about the mentoring, and that mentoring, how powerful it is. And I want to revisit that too. I want to ask you just briefly, because pain management was so strong in your practice and what you have been, the patients that you're attracting, were you using referrals out to therapists as well in that situation?
Well, you know, when I first started, we were just so busy dealing with patients that had lost their doctor. So we had a pretty busy first few months. And then once we started caring for the patient in front of us, then the physical therapists that they may have been working with started to refer patients to us, and they started having physical therapists even come in. They were excited that here was a pain doctor that wasn't putting their patients or their clients on opiates. And then I had a psychiatrist, a very well-trained, very busy, phenomenal psychiatrist who one of my patients saw, and then he started sending me patients. And that's kind of how so I actually never pursued a referral base. And this is what I've told those colleagues who have joined our practices: focus on the patient in front of you, and that will become your referral base. Now, I do think that I had a unique situation where I had a practice with lots of patients already, and many of those patients already knew me because I was already working in the practice for about 9 months before my best friend passed away. But if I do think it makes sense to go out and try to generate referrals and promote the fact that you are going to be different. And that's what's different about what we were doing here. And I would tell people that I would run into, physicians that send their patients to see me, they don't have to worry that I'm going to send them back intoxicated with opiates, because it's not going to happen. And so I think that's one way someone might generate more referrals, is to let them know that they're going to be using nutrition and lifestyle to relieve pain.
Yeah, it's amazing how the public are driving that incentive so much, is they don't want to go the medication route. I mean, sure, there are that percentage that want the quick fix, but amazingly, the majority of people actually are looking for alternative solutions.
Mm-hmm, that's true.
So, yeah, so let's move on a little bit just to the way you learned functional medicine. How did you get educated? What is that process for you? Can you just walk us through that briefly?
So originally, I watched one video that David Jones put together, and he talked about being a healer. He talked about connecting with the patient, and that's what pulled me away from law and back into medicine. Really, it did, because I was like, that's why I became a doctor. That's what I want to do. I've always been fascinated by the idea that all the things that have happened to a person in their life from the time they were born, all the decisions they made, some of the decisions that were made for them, those things impacted them to bring them to the state of health that they're in that moment. It's really fascinating when you think about it. All the things, if you stopped and thought about it, it's really mind-blowing. And that's kind of what functional medicine looks at, okay? So it was very easy for me to take my first course. And the first course I took was the international conference, which was on the heart, which was in 2012 in Arizona. And when I went to that first conference, that was it. I was like, if I have to scrub toilets, if I have to sell my car, I am going to every conference that they have after that. So I was fully invested in the value of learning functional medicine. I felt that the money was really not even important to me, because the knowledge, the idea that I could bring passion back to what I did, that I could actually help people with a chronic illness, was enough that the money was an issue. So I went straight through all the functional medicine modules as fast as I could. Now, one thing that I did do, which I think helped me train, to your point, is that when I came back to practice, in my practice, I went ahead and started incorporating. I didn't wait to get all of the APMs under my belt. I didn't even wait actually to get the introductory course. I brought what I knew and started applying it. And I want to encourage those that are engaged in the fast track to just go ahead and apply what you know immediately. And I had some help from mentorship with my colleague, but it was really another doctor and I, a naturopath, who was kind of learning at the same time, and we stayed with the practice. So we kind of bounced things off each other. And I never really had the benefit of a mentor, from that point on, actually. So I think this is a unique opportunity for your clients to be able to get involved with someone to bounce ideas on, but don't hesitate to get started with what you know can be helpful. There's so many things in functional medicine that are not going to hurt someone, so they can get started. But that's how I started my training, and I took the exam as soon as I could. So I was with the second group of examinees, and it just never stopped from the beginning.
Yeah, and what time period was that you kind of got that all together?
It was just under 2 years, which is about as fast as you can usually do it. Now, at that time, they didn't have 2 APMs on the same weekend, so you'd have to go, 1 APM at a time. So you might even be able to do it a little bit faster now. But I don't even think that's necessary. I think the key point I want to make here is use what you have learned. That will cement it into your repertoire better anyway. And you're also, you are going to make some mistakes in the beginning. Luckily with functional medicine, they're not going to be harmful. They're not going to be deadly mistakes. But there are things that I look back on that I did in the beginning because I just didn't know, that I would never have done. I would have changed it. They were limitations because I just hadn't learned enough. But those patients were not harmed. That's the beautiful thing too. I tell my patients that I may not get everything better, or you may not get completely better on that first few visits, but something will get better. Something will get better. Something gets better. And so even though I hadn't had all the training, patients were getting better. My practice was building.
That's great. Yeah, I love just your enthusiasm, how you got into it so quickly. So people think about it and just never get it going. And so in your instance, and you went through it rapidly as far as a 2-year period goes, what do you feel now looking back could have actually made that better and accelerated you into functional medicine, getting better results quicker, if you had to think of something?
Well, I do think that it would have been helpful if I had someone that I could call and ask questions about. Because I really didn't have that. I would have had to wait for the next APM, and that could have been 6 months, 9 months, or even a year, because they were only offered at certain times. They were not online. I couldn't do them. I couldn't take them at will. I had to wait until that month came, and I had to go do that. So, for example, the last module I took was the hormone module, and I learned a lot at that hormone module that I didn't know. The first 2 years, the first almost 2 years that I practiced. So I think what you're doing, Garric, in allowing your clients to go straight in and ask questions when they hit a roadblock. How do I get around this? Or here's an unusual situation. How would you handle this? Being able to have some coaching and some mentoring from the get-go is really going to allow people to to sort of not stop and start and stop and start, but to continue to go right through. So that would have been helpful if I had had that.
Yeah, I know from my perspective as well. And I went exactly through the same situation as yourself. And I felt that was one of the big stumbling blocks why it took us years to kind of just get all the information, get our heads around what it is, probably had a little bit of blood along the way, and then we could really get going. And nowadays we know we just have more functional medicine practitioners out there. Mm-hmm. And we've learned from kind of not our mistakes, but the way it has been done in the past, and maybe not done more efficiently. Mm-hmm. Maybe can you give us an example of some patients that you've seen today? I know you get some really complicated patients, but can you give us just how do you see a patient? What type of patients are you seeing? What's the process that you walk through a patient?
So, well, I'll tell you one patient that I just adore that came in last fall with the diagnosis of Alzheimer's disease. And her loving husband brought her in and said, look, you know, she's been on medication for 2 years. There's been no improvement. She has the diagnosis of Alzheimer's disease. Now, it was interesting because the patient came in and she had a fracture in her foot as well. So I asked her, what did you do? Like jump off a cliff, get run over by a car? You're riding a horse? What was going on here? How'd you break your foot? Because I kind of suspected it was probably a fragility fracture. And sure enough, she had just missed one step and shattered her foot. And she was on a bisphosphonate. And I was like, you're on a bisphosphonate for 20 years. It must not have done a very good job because you missed a step and broke your foot. I bring this all up to say I ended up using the Bredesen protocol, which is functional medicine based. I mean, they're just a marriage of two great ideas that happen to correlate quite a bit. So a lot of the functional medicine work that I would have already done reiterated through the Bredesen protocol. But we went through that. And what was so beautiful about it is when she came back in the future follow-ups, which it hasn't even been a year, quite frankly, that fracture healed. Her cognitive function improved so dramatically that she then ended up managing the medications for her husband who had surgery later. That's how sharp she was, incredibly sharp. And her cholesterol improved dramatically, and she was pre-diabetic and no longer pre-diabetic. So here's one set of tools, the functional medicine matrix, the functional medicine timeline. We incorporate some things we see as necessary, did some blood testing. We did major blood panel, and I don't even think we needed to do stool with her. We may have just done blood. But when we started managing her vitamin D and all the things that you're going to learn when you do functional medicine, look at that, 3 major conditions completely reversed in record time, and not a single drug was given. I mean, it was just, I just love that. It's like what I call an economy of purpose. Well, I'm trying to work on this one thing, but all these other things got better. Now, how did that happen? So that was one super awesome patient I had. I have another patient who had been to the Mayo Clinic. She had joint pain. Nobody could find out what was wrong with her. She'd been, to lots and lots of doctors. Like I said, even went to the Mayo Clinic. Nobody knew. Put her on the elimination diet. She came back to see me. She refused to be on it because she would not give up like 2 things. I know one of them was Diet Cokes and something else. I just looked at her and I said, you spent all this money and all this time. Why don't you just do it? Why don't you do it? Somehow I was able to convince her to go ahead and give up those Diet Cokes and whatever the other food was. It might have been dairy. She came back, all the joint pain was gone. She was so grateful. So that's another example of simple things that you learn. And one of the things too, and Garric's going to help teach this as well as the other practitioners, is how to coach patients into change. This is not something that medical doctors are trained in. We're trained in, here's a prescription next, here's the injection next. I do think physiotherapists at least have a little bit better experience trying to get patients to do their exercises at home and whatever the things that you do. But to be able to coach a patient into giving up the thing that they will not let go of, like that Diet Coke, if you can get them through that, they might get better. And I'll tell you, a third patient who had a rash, it was kind of cute, I'll try to go fast, who had this terrible rash, had been all these dermatologists, had been on tons of expensive creams, antibiotics, was never getting better, refused to do the elimination diet. I did kind of the same thing with her. I was like, go ahead, come on, you spent all this money, do the elimination. Just give me 3 weeks. Can you just do 3? She finally did it. And I didn't see her back. Didn't hear from her. And I kind of thought, well, she probably never did it. She called me about 4 or 5 months later, and she said that she had moved and she wanted to find a functional medicine doctor in Arkansas because the rash went away when she finally did the elimination diet. And I was like, voila. You know, I mean, the elimination diet is free. You know, all those expensive creams, you know, they didn't touch it. So that's just 3 quick examples for you.
Simple willpower and discipline, and sometimes we've got to coach that in and encourage and empower the patient. So yeah, just love it. I wanted to ask you, I know one of your big passions is osteoporosis, and you've done some phenomenal talks with all the certified practitioners at the institute, at the advanced level. Can you give us just some clinical pearls around osteoporosis that shatter the conventional paradigms?
Yeah, okay, I will. I just had another patient come in. She's a judge in the area, and she, I keep telling them I have 100% success rate converting osteoporosis or improving DEXA scans, you know, and each of my patients gets nervous. I don't want to be the one to blow your record. I'm like, it's okay. But she didn't. I mean, they're still getting better. She was just thrilled that her mother had been on a bisphosphonate and had some jaw necrosis. So she was bound and determined not to go on a bisphosphonate when she was diagnosed with osteoporosis. And I use a mnemonic because I'm a little ADD. You may have figured that out. I think, you know, or whatever, or maybe I'm just postmenopausal, whatever. I can't always keep up with things. So I have this beautiful mnemonic because I want patients, you know, I see myself as a doctor meaning the word teach and teacher. So I want to teach my patients sort of the rationale for why I want them to do things. I feel like they're going to be more compliant that way. Okay. So I have this little mnemonic and it goes like this: grows B. And the G stands for gut absorption or healthy gut, because giving somebody calcium, giving them vitamin D all day long is not going to help them grow bone if they can't absorb it. So absorption is really important. And so for some of my osteoporotic patients, when you're looking at a root cause, it may be the fact that they can't digest and absorb their fat soluble vitamins like vitamin D and their minerals like calcium and magnesium and boron and strontium and all the things that you need to build bone. So that's the very first step. Before you give them a supplement, let's just make sure the gut's working. So I would like that to be first. The second one is R for the right raw materials. So make sure they have all the right raw materials. You can't make bone out of just calcium. That's like, you know, building a house with nails. You know, it's not going to work. You need all the ingredients, okay, that the bone is made up of. And we now know that bone is a very complex compound that our body makes, and it needs a lot of different things, even phytonutrients, a lot of things they're finding. So I like to make sure that the patient is getting all the raw materials, not just calcium. The O stands for optimizing hormones, and this doesn't mean just sex hormones. Also thyroid, making sure that the patient's not hyper or hypothyroid, making sure that they don't have excessive levels of cortisol, which we know can actually inhibit bone growth. So those are things that we want to look at. Obviously, sex hormones. If the patient's willing to have sex hormones, a little bit of estrogen goes a long way in building bone. Same with men with testosterone. And then W stands for withdraw bone saboteurs. I mean, I had to make this thing a mnemonic, but the W really does work. It's very important. What sabotages bone growth? If I want to build bone without giving you a bisphosphonate or another medication that has a lot of side effects, I need to make sure you're not doing things, you're not undoing that bone growth, which excessive alcohol, excessive caffeine, getting those steroid injections or being on steroids, certain medications, stress itself. These are some of the bone saboteurs. And so in the lecture, you know, I talk a lot about the things that we want to try to eliminate from the patient so that they can build bone. And then S stands for stimulating bone growth. So how do we stimulate bone growth? I think people think that all I have to do is get out and walk. You actually have to place tension. And as a physiotherapist, you guys are excellent at this, but you have to place tension on the bone itself, right? That's what's going to stimulate osteogenesis. It's that stress on the bone. Well, where do we attach our vertebral bones? Our vertebral bones are attached to things like the psoas and the iliacus and those other muscles. Those are things, what I tell my patients, the muscles that have us have good posture. When we're holding our stomach in, we're holding our shoulders back, we can't do that all day because it's exhausting. And that's because they're stressing those bones, the muscles that hold those bones in place. So I always talk about vertebral When people have vertebral osteoporosis, we need to work more on that versus osteoporosis of the hips and the femur. That's going to be more weight bearing. And so these are things that we want to look at, stimulate both sets of bones, which are super important, as well as our wrists. The DEXA doesn't look at the wrist, but the wrist is a fracture that can occur from osteoporosis as well. So we want to make sure that we do things that stress the bone so that it will stimulate growth. That's the S. The B, the GROWS B, the last B stands for balance and fall prevention. So what's the point of all of this? If my patient's walking around in the dark at the house, I do an exercise in the office where I have them stand on one leg. And then I have them do it with their eyes closed to make a point that it's important that as we get older, that when we're out walking around the yard, when we're walking in the house, don't think because I've done it. I'm just going to walk over here and grab that light. No, you're going to trip over the couch and break it. And a lot of accidents happen at home. So I like patients to understand that having the house well lit is part of their fracture prevention, if you will. And also they can do exercises, and physiotherapists are great at teaching exercises to improve balance, making sure they don't have a peripheral neuropathy, which puts them at risk for a fracture because they can fall. That's a lot, but if you remember that little mnemonic, GROWS B, you can quickly run through those with your patients and address sort of the gaps in building bone.
Well, that is so enlightening, and I hope if anybody takes anything from this interview, it's just take that and apply it. I mean, because that is just golden, and I know you've developed that, and hopefully you patent it someday and teach it more. So what I would love to chat about and just hear from you is, I know you've built a phenomenal functional medicine team. Your practice is growing all the time. I know you're expanding, looking for new premises. What is the importance of building a team, working with a team, and establishing that everybody understands functional medicine and has their certain expertise?
Yeah. One of the big things in our practice, which I really believe in, and I kind of touched on it earlier, is education. So I want as much exposure from the receptionist to the phlebotomist in the practice. I want them all to kind of know why we do what we do. So they understand that, why I want to weigh the patient each time, why it's important to get an accurate height. For example, I believe that when people understand why you want something done and they see the value in it, they'll actually follow through and do it. And I talked about that with patients, but I also believe that about staff. So the staff is more likely to get an accurate weight and accurate height when they understand that I'm trying to pick up on early osteoporosis or fractures or loss of muscle mass or loss of vertebral body height. These are things I'm looking at. And when they understand there's a reason why I want to do something, then they're on board. So I do pay for my staff to go to conferences. I try to bring them to as many local conferences as possible so they can learn as much as they can. That way everybody's kind of on the same page. We're now looking for, I do practice acupuncture, but my consultative practice in functional medicine is busy enough. We're now looking for an acupuncturist to come in. And that acupuncturist will learn a lot about functional medicine. We do use scribes in our practice. And this is something that's kind of unique that I'm glad that I do. The scribes allow me to focus one-on-one with the patient, to look them in the eye, and to be sort of percolating in my brain a plan that is unique and tailored to them and their circumstances and their history. I couldn't do that if I was trying to type at the same time. I just personally wouldn't be able to do that. I'm maybe taking notes, I'm listening, I'm making eye contact, I'm connecting with the patient. And part of the fee that the patient pays, of course, covers the expense of the scribe. The scribes in our practice are trained by sort of a master scribe first, so they know what to look for and what's important. And then I review what the scribe writes, so the scribes kind of learn what we want and what's important and what have you. The scribe ends up being somewhat of assistant to me, so the patient gets the most out of their appointment. So that's something unique about our practice. And we're lucky enough in our practice right now that everybody has a little bit different skill set. So one of the practitioners has extensive experience in ENT, and she's board certified she's functional medicine certified through IFMCP. We have a family practice physician who's the sequence was off, but she's ready to take her exam as well. I have the pain management background, and we have a PA as well who has experience in ENT and allergy. So we have a varied group of people here, which I find very good. And we do have some health coaches. We just had 5 of our staff members become certified through FLT. If you're familiar with that, Metagenics has a program called First Line Therapy, which very closely mirrors what is taught in functional medicine. So we were lucky enough to train our staff in that as well. We have a health coach who has a background in social work. So she's not just a nutritionist. She's used to working with families and social work. So I find her very unique in that sense. Many patients will tell me, I know what to do, I just won't do it. Or I know what to do, but I have all these excuses. And that's when I like them to talk to her, because she is the master person that's able to figure out how to get over those roadblocks of, I travel a lot, or my kids won't eat this food, those kinds of things. So instead of the time that I spend with the patient discussing that, I let the health coach go over that with the patient so that they don't feel rushed and they can spend a lot of time going into it. So that's what we have. We're getting ready to incorporate heart math into our practice, and we are going to use getting an accurate body impedance analysis so we can find out how much fat and how much muscle a patient is losing or gaining. I find that's very, very important to me that we focus on where a patient loses the fat. The fat needs to be lost, obviously around the viscera, around the abdomen. And so those are some of the things that we're doing right now.
How many of your patients do you find get to a point where they're feeling okay, but they continue to come to see you on a regular basis as far as just keeping their numbers right, keeping their wellness, moving towards optimal wellness? Traditional medicine is so about we discharge a patient and wait for them to have a recurrence before they revisit us. Whereas in functional medicine, we always want to move them towards optimal wellness. And in that time that we've had to build that therapeutic relationship, that's part of our empowering talk that we have with them, is to teach them that their numbers need to be at an optimal level. Are you finding this in your practice? And what are you finding the engagement rate after that with patients wanting to see you again, just from a wellness perspective and a follow-up?
Well, I would say it's probably about 70%. I haven't figured it out perfectly, but I would say, and I am starting to look at that. It's interesting you brought that up, because I am starting to look at that. I would say it's probably about 70% that continue on. Some people have an acute issue, and that issue gets better, and they're good. But it's the young people are the ones that don't tend to continue on because they have a certain issue that's gotten better. But the patients that have cholesterol issues, patients with sugar issues, they want to stay engaged, because we use some of the testing companies that have sort of a red, yellow, and green marker, and they want to get their greens. They come and they say, "Oh, I see some red." They want to, and I love that we have that, because it's a benchmark that encourages that patient to stay on task. And from a very ethical standpoint, that little prod, that little, like you call them, niggle, I think sometimes, right? That little voice in your head is just kind of, you still hear it kind of irritating you in a good way. That little thought process gets them to kind of maintain a good healthy plan, good lifestyle, good eating plan, because they know they're going to come see me again. They're going to have to look at those red, yellow, and greens. So we have a lot of fun. Now, one of the things that I think I really want to have patients stay engaged long term. So the way I build, this gets into a little bit of practice management, which may be helpful for you, but and we may change this at some point, but I bill like an attorney. So if I bill for time, so if a patient, and the thing I love about that is it allows me to treat patients with all different sizes of pocketbooks, for example. So if I have a patient who can't afford, they get scared and say, "Well, I can't afford to see you," I say, "Look, you can make a 5-minute appointment. You can do a 10-minute appointment. Those prices are around a regular copay. And that way we can still stay engaged, and the way to keep the appointments shorter, keep your questions to a minimum. I will prepare for the appointment, and we'll go as fast as we can, because I don't want to lose them." And then it also allows patients who want to come in with 3 books that they read and bags of supplements they want me to review and labs they want me to review, and they want to have a discussion. That's also available too. And I change the pricing based on the amount of time that they spend. And I think that's a very fair way to do it. So I think that's part of how I'm able to maintain patients long term, because we are an out of network. We don't accept the payment from insurance typically. We're considered out of network. So.
Got it. Yes, I mean, that is, and it's a place of safety for them because they know that you want to move them. You've got the skill level to move them towards optimal wellness.
Yeah.
There's a lot of value in that. And hence why your practice keeps growing, because you're not losing and just looking for another patient.
Right.
So maybe the last couple of questions. I just hear so often people saying they practice functional medicine, and when we hear what they're doing, they're often using the conventional medicine as an excuse. In other words, one symptom, one supplement.
Yeah.
Not going. And we know in functional medicine, the definition is using a systemized approach to identify the underlying root cause while we build a therapeutic relationship. So that's systemized approach. Can you speak a little bit around that and just get people's head around functional medicine is not another weekend course that you can go and jump on and start and understand. It's a process to understand. And what the joy of functional medicine is, it's had this ability to bring it conceptually into a systemized approach that makes it a lot easier. How have you found using that approach in your practice as proper functional medicine so much easier than the conventional one medication, one symptom?
So like I was saying before, if one medication, one symptom may get rid of that symptom, but it doesn't have this sort of feed forward where lots and lots of symptoms get better almost magically. I mean, it's really amazing how functional medicine works. What we do use instead, and I have seen that, and I have patients come in from other practitioners where they have bags and bags of supplements, and I think I don't want that reputation as to be a supplement pusher. I don't want to exchange, like you were saying, the old one prescription for one symptom to one symptom with one supplement. That's really important that not happen, because I think it will destroy the beauty and really the underlying theme of what functional medicine is about. Functional medicine is about bringing the body back to homeostasis, paying attention to biochemical variations, and addressing and tailoring to that, not just a standard of this person is stressed, so I'm going to put them on a particular supplement, and getting to the root cause. So how do you do that? This is what's different completely about integrative medicine, conventional medicine, even complementary medicine. And it all goes back to using the timeline and the matrix. That, to me, and even when I teach, at the AFMCPs, that is what makes us uniquely different. If you think about it, from an integrative practitioner. I mean, hugely different. We are using that timeline, that matrix, as a very powerful tool to help us figure out what the cause is. And also we can, and I encourage clinicians to go back, and I do it all the time. We always scan in my handwritten timeline and matrix, because I'm going to review that. If my patient's not reaching the goals that they want, I'm going to go back to that original timeline and see if I missed something. Because a very well done timeline and a very well done matrix is going to allow you to find the answers. They are going to be in there. They're going to be hidden in there. And if they're not, you may go back to it and pursue a little bit more questioning. So I want to focus on, when you use the timeline and the matrix and you're looking at those very powerful modifiable lifestyle factors, which are the base of the matrix, that's where all the change and the power of health come from. They come from sleep and exercise and relationships and stress reduction and nutrition. And that none of those say supplement. Not one of them. Not one of them says supplement. Isn't that beautiful? And so even you know, I have a lot of patients that come to see me on the first appointment, and I have to turn to them and say, I many times give them magnesium because so many people need magnesium. It does so many wonderful things. So generally they'll leave with some magnesium if they're not already on it. But I'll say, I hope you're not disappointed that I didn't give you a whole bunch of supplements to buy. And so I like to do some testing. And then from the testing, when they come back and I can see they have elevated free fatty acids, or they have a low vitamin D, or they have signs of endothelial dysfunction, or they have some insulin resistance, then I can come tailor a particular supplement that might help assist them reach their goals faster. But it's certainly not a requirement that they be on supplements. And it goes back to kind of like I was telling you with the osteoporosis about how the gut is so critical. Why give them supplements if the gut's not working? Kind of goes back to, I tell my patients, no supplement is going to undo a terrible diet, okay? And the power of movement, it touches all elements of the matrix. It's so powerful that if they're not incorporating movement and they're just taking supplements, they're just not going to reach their goals. So don't underestimate the power of those the bottom foundation of the matrix. And I think when you test a patient and find they have a deficiency, they're going to be more likely to take that supplement because they can see that there was thought and investigation tied into it. So.
Yeah, that's golden. I mean, a supplement is a supplement. It's once you've got the base right, then it's there to just boost it to the next level. And I mean, it's so interesting. You know, we're taking a group through the 5-day fasting mimicking diet at the moment, and that's about depletion. Mm-hmm. So there's no supplements, very little food on that. And what that does is upregulate certain genes to create more health in our body by removing certain older cells and less optimal cells. And it's a similar concept in that short space. So yeah, it's lovely to hear. So Dr. Ball, maybe the last question for today, and then we can start to round up, is a common factor with a lot of functional medicine practitioners tends to be that they want to really serve their patient at the highest possible level. That's like in the heart, and probably what moved you from turning that corner toward being a lawyer. And functional medicine can now help those patients to the highest possible level. So what bit of advice can you give for those out there that are listening in and they have that in their heart, that they want to serve their patients at the highest possible level, but they feel a bit stuck, they're a bit scared to invest in themselves, to learn functional medicine and move on to help those patients? What encouragement can you give them?
Well, first of all, like I said before, when you start doing this process, people will get better. In every single case, something gets better in patients. Something gets better. They may still have a rash, but they're sleeping better. Or they may say, you know, I have a lot more energy, but my knee still bothers me, but I noticed I could walk at the gym or the grocery store for a longer period of time. So first of all, number one, when you learn this, you will be successful, okay? Things will get better. And secondly, just don't stop learning. Never stop learning, because medicine and or the medical arts, I should say. I shouldn't just say medicine. The medical arts are always changing. We're learning new things all the time. So if you are the kind of person who wants to help people and you love to learn, you're primed for this. This is made for you. You know, to be able to connect with people and continue to learn. In functional medicine, one of the things that I pray a lot of times, I prayed this when I first started, I would say, God, keep me little and keep you big, okay? So in other words, to keep me very right-sized about the fact that in functional medicine, the hero and the healer is within the individual. It's not within me. I'm more the coach, the teacher, the investigator. But all the healing and all of the credit goes to the patient. And I love that. I love that humility in it, right? It's just beautiful. It's very spiritual. So get out there and do it.
Exactly. Just do it. So often your energy there, your heart is there, and then it's just like, what is stopping you? Because people need you. We need more functional medicine practitioners. So if your heart is there, we just say kind of follow. And, you know, first of all, I just want to thank you so much, Dr. Paul. This has really been so tremendous just to get your wisdom and your insight and hear your story. It's very, very inspiring. And this is why we love working with you at the Functional Medicine Fast Track program, and we're great friends. So I want to encourage everybody that just wants to maybe take the next step. The easiest is go to our website, www.functionalmedicinefasttrack.com, and there are a ton of more videos there, and you will just get more of what functional medicine is and what it can do for you. The shortened version of that is www.fm-ft.com. So just the first letters of Functional Medicine Fast Track with a dash in the middle. And that is the quicker way to type in and go to our website. So again, just thank you so much, Dr. Paul. It's been a pleasure having you on, and we hope to have you again soon and hear more of your amazing wisdom.
Thanks. Bye, Garric.
Cool. Don't go.